Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is 10 warning signs of Alzheimer's, sponsored by Prince George's County Government and the Department of Family Services.
Good evening, everyone. Thanks, Dominique, and thanks, Dementia Friendly, the PG chapter, for having us this evening present on the 10 warning signs of Alzheimer's. Let's go to the next screen. And in this evening's presentation, here are the things that we are hoping that you'll take away. We're going to describe the typical age-related memory, thinking, and behavioral changes that occur both in those who might have dementia or Alzheimer's, and what's typical normal aging, recognizing the warning signs related to Alzheimer's and dementia, discuss the tips for approaching someone about memory concerns, explaining the importance of early detection and benefits of diagnosis. And let me say, not only in terms of early detection and the benefits of diagnosis, the benefits of being involved in either a clinical trial or clinical research are also critical. Identifying possible tests and assessments for the diagnostic process. And in addition to the resources that Dementia Friendly of PG is offering, also ensuring that you all are aware that the Alzheimer's Association's National Capital Area can be a partner, an additional resource in helping loved ones with Alzheimer's, helping caregivers, things of that nature. So those are our objectives for this evening. Next slide. And in the course of the presentation, we have a fictitious family by the name of the Garcias. We're going to go through what's going on with them. So why don't we go ahead and meet them now. Mary is the mother. She's a widow. She lives alone. She's a retired school teacher. She's been very active. She's a meticulous house cleaner, things of that nature. Her daughter Lydia lives in the area, and she's begun to notice some issues with her mom. She's noticing laundry's piling up, junk mail's piling up, and her mother's not as meticulous in her housekeeping or other duties as she's been in the past. And then the other sister lives out of town. She lives in another state. That's Patricia. Unfortunately, Patricia works long hours, and so often she's relying on her sister Lydia to keep her informed as to what's going on with their mom, Mary. So we'll kind of follow the Garcias. We're also going to have actual experts affiliated with the Alzheimer's Association giving some pointers during this evening's presentation. So why don't we move to the next slide. And here we see a text between the two siblings. One of them says they're worried about mom. The other one says, oh, it's probably normal to get a little forgetful. The other one says, but it's so unlike her. Should we worry? The other sister says, let's reach out to Dr. Soloway. And again, Dr. Soloway is a real neurologist. He's been a consultant to the National Alzheimer's Association. So let's hear from Dr. Soloway.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So three critical things I want us to focus on, taking away from what Dr. Soloway said, that it's happening more frequently. So it's not just a day-to-day matter. We often can, as we age, I'm in my 60s, I might forget somebody's name, I might forget my car keys, but I can retrieve my steps and find, oh, I left the car keys upstairs in the bedroom, or I go into the pantry, what am I going to get? Oh, that's right, I'm getting ready to make some pasta. I need to get the sauce. So that's typical. But again, misplacing things on a most daily basis or dealing with issues on a more day-to-day basis, those are concerning, and they may indeed be the warning signs for potential Alzheimer's. So let's move to the next slide. And here we're wanting to talk about the distinction between what is dementia, what is Alzheimer's, and why is it important to know the signs. So dementia is what I would call an umbrella term. And we're going to hear more about that now from an expert.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual. But there is also some overlap in behaviors among the types of dementia.
Okay, so again, dementia is umbrella term. That's almost as if when somebody says, I have heart disease. Well, what are you talking about? Do you have an arrhythmia? Do you have coronary artery disease? Or somebody says, I have cancer. Well, what type of cancer? Do you have sarcoma, breast cancer, uterine cancer, that sort of thing? So again, dementia is an umbrella term. Now let's focus a little bit more deeper on exactly what Alzheimer's disease is.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
And just want to point out too that Alzheimer's affects 1 out of 10 individuals over the age of 65. And again, it's a progressive disease that impacts not only thinking, but memory and behavior. So the 10 warning signs we're going to touch upon this evening, and let me just highlight each one of them very quickly. Memory loss that disrupts daily life. And I want to underscore disrupting daily life. Again, from time to time, we might forget something, car keys, et cetera, but that's an occurrence, one time, or very infrequently. But when it becomes persistent and it's impacting daily functioning, that's serious and that needs to be attended to. Challenges in planning or solving problems. So somebody, again, who is accustomed to baking or word puzzles, or they're a seamstress and they know how to cut patterns out and sew, they know how to do word puzzles, things of that nature. And if they're having persistent challenges, that's disconcerting and needs to be attended to. Completing familiar tasks. So somebody who, is an artist and they know how to paint or they know how to sew, and they can't paint like they used to. They can't remember the colors. They can't remember where they put colors. That's disconcerting. Confusion with time or place. They don't understand what day it is, what month it might be, things of that nature. Trouble understanding visual images or spatial relationships. And we're not talking about things like cataracts or other eye diseases. It affects what's called the perceptual area of the brain. So they may not understand they're walking down steps. They may be out, as was the case my late wife had Alzheimer's, when I would drive and somebody was coming into the adjacent lane, her perceptual, spatial, she thought literally the car was coming on top of us and she would get honestly kind of freaked out. Number 6, new problems with words or speaking and writing. We recently heard about Bruce Willis, who was diagnosed with frontal temporal lobe. He had issues with aphasia. You can have receptive, meaning not understanding words that are spoken to you, or expressive, not being able to say the words that you want to say. Number 7, misplacing things or losing the ability to retrace steps. 8, decreased or poor judgment. Withdrawal from work or social activities is number 9. And then finally, changes in mood and personality. So now we're going to dig deeper in each one of these. Let's go to the first one. So the most common sign of Alzheimer's is forgetting recently learned information. And they include forgetting important dates or events, asking the same questions over and over again. What day is it? It's Thursday, and 5 seconds later. Is today Monday? No, it's Thursday. Asking the same questions over and over, increasingly relying on memory aids. So somebody might have sticky notes all over the place, or they may have other notes written down. They may rely on a particular family member. That, you know, Joe, what TV, where are we going? Joe, what time is it? Joe this, Joe that. And so again, they're really relying on people. Some typical age-related, sometimes, and I underscore sometimes, forgetting names or appointments, but remembering them later. So that's typical. I want to make sure we're clear what's typical aging versus what might be signs of dementia. So now let's click on this icon, and we're going to hear from an expert.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago. Because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking this, that was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things, and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
So that's the gentleman with actual Alzheimer's. Next, some possible signs: difficulty completing familiar tasks, driving to a familiar location, organizing a grocery list, remembering the rules of a favorite game. So again, people with dementia have these types of difficulties. And again, they may be fairly persistent as they are increasing. On the other hand, typical age-related, occasionally needing help to use the settings on a microwave or a record player, or how do you record something? I honestly am tech challenged, and that's why, thank goodness, Mr. Watson's joining me to run the presentation this evening. But we all have those kinds of things. How do you work something, as an example? But if we're seeing somebody having difficulty not understanding where they're going, and they've been that route thousands of times, or they've gone for a walk in the neighborhood and they got completely turned around, that's majorly disconcerting and needs to be a sign of concern that needs to be assessed. Let's click on this video to hear again from an expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
So the interesting thing is seeing how somebody has changed. They're meticulous with their finances, and now they're having struggles, that sort of thing. Why don't we move on to the next slide? Confusion with time or place. So that means that somebody, again, is having trouble understanding something if it's not happening immediately. So, we're getting ready to approach Good Friday. Some of us might be going to services tomorrow, and somebody's like, when's church? When's Easter? Easter's this Sunday. That sort of thing. Forgetting where they are or how they got there. Perfect example, again, my wife unfortunately had Alzheimer's. She thought she had a doctor's appointment and ended up going to her doctor only to be told by the doctor, Mrs. Smith, your appointment is next week. That sort of thing. Again, typical age-related, getting confused about the day of the week, but figuring it out later. Oh yeah, tomorrow is Friday, April the 7th, and it's Good Friday for those of us who are religious or observant. So why don't we go on to the next one. Trouble understanding visual images and spatial relationships. So there's issues with difficulty with balance, trouble reading, problems judging distance and determining color or contrast, which may cause issues with driving. So again, I mentioned earlier, my wife, as her illness progressed, her visual spatial was majorly compromised. She couldn't understand how to come down the steps. We would have to help her, or even going up the steps. It looked like, I guess, she couldn't articulate it. I can only imagine it probably looked like one big black hole as she was trying to come down the steps, that sort of thing. On the other hand, we're talking about visual issues. As we typically age, we may have cataracts, we may have glaucoma, an actual medical condition that's impacting our vision. So just want to point out that distinction. And here we're going to hear from an expert that will give us a little bit more insight.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Mm-hmm. Okay. Moving on to number 6, new problems with words in speaking or writing. People living with Alzheimer's may have issues with conversations and communications. They may stop in the middle of a conversation and have no idea how to continue. They can't find the word, if you will. Again, they may repeat themselves, saying the same word over and over, or making the same statement, or asking the same question. They may have trouble naming a familiar object or use the wrong name for something. On the other hand, typical age-related, sometimes having trouble finding the right word. And, we may take a minute and then we're like, oh yeah, this is what I was trying to say. But when we have potential dementia, it's really, really a challenge coming up with that word or struggling with vocabulary. So we're going to hear from Phil, who's an individual living with some form of dementia. When we click on that quick video.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
Okay, moving on to number 7. Misplacing things and losing the ability to retrace steps. So a person with Alzheimer's disease may lose something and not be able to recall where they put it or not being able to find it. Sometimes we've heard stories of individuals putting their car keys in the microwave, or I know my wife in the early phase of her illness, I had her in daycare, but she was able to come home after daycare. But then she would hide her purse and swore somebody stole her purse. She'd hide it under the couch, she'd hide it under the china cabinet, and would have no realization that she had actually done that. She had put it herself. And that also leads then to people being accused of stealing something, and that happened. I came home from work and she's like, somebody took my purse. I'm like, what are you talking about, Bernita? I can't find it. I eventually got a key finder thing that I attached to the keys. And so when she said that, I could click it and it would beep, 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 and I knew where her purse was. Again, more typical age-related, misplacing something, and then again, we can retrace our steps and find them. We've shared some of those examples earlier. Now let's hear from an expert giving us a little bit more detail on this one.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in and they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Okay. So moving on to number 8. Decreased or poor judgment. So again, some possible issues for those who have Alzheimer's, using poor judgment when dealing with money. Oftentimes there may be a telemarketer calling or somebody knocking on the door or things coming in the mail and a loved one is donating money to almost everything. They've given out their personal information over the phone, that sort of thing. They're paying less attention to grooming or keeping themselves clean. So they've not bathed, they've not changed clothes, things of that nature. They may, again, telemarketer or somebody's at the door. And I remember one time, as a real life example, some guy was, believe it or not, this was about 9 years ago, selling vacuum cleaners, and my wife let him into the house. Why would she do that? But again, she couldn't understand what was going on as her Alzheimer's continued to increase and her functioning declined. On the other hand, more age-related, making a bad decision or mistake once in a while, but again, realizing what we've done and making some changes. Gee, I forgot to get my oil changed. I just realized this afternoon, I looked at my glove box and I was like, oops, I was supposed to have my emissions control test March 29th, and here it is the 6th of April, so I have to pay the fine or whatever it is and go get my emissions test in the morning. So now we're going to hear from Teresa. This is a woman living with Alzheimer's and how she's experienced issues around poor judgment.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet rat, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Okay, so moving on to the next sign. Withdrawal from work or social activities. So again, people are having difficulty understanding conversations. They can't keep up with things. Maybe they can't follow patterns, steps, that sort of thing. And as a result, they're withdrawing from hobbies, from social activities, or other engagements. They're also having trouble keeping up with familiar activities. Somebody's an avid baseball fan or football or soccer fan, and they're not able to follow the game, whatever is going on in that regard. On the other hand, sometimes feeling uninterested in family or social engagements. Oh, I just don't feel like going today. I want to stay home. I'm tired, that sort of thing. Let's click on hearing from an expert to give us a little bit more insight on this one.
One of the most common changes and early on is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
Okay. So moving on, finally, to number 10, changes in mood and personality. So again, Alzheimer's is not just about memory. People living with dementia or Alzheimer's may struggle with confusion, suspicion, depression, being fearful or anxious, particularly as the illness progresses, getting easily upset at home with friends or when they're out in social situations. And as the illness progresses, oftentimes what ends up happening is that loved ones, caregivers, if you will, keep their loved ones at home because they don't function well out in social settings. Age-related, typical development very specific ways of doing things and becoming irritable when a routine is disrupted. My mother, who's going to be 90 next month, she gets up, she has her breakfast, she reads the Washington Post every morning. I remember one time I said, Mom, I'll come over early and take you grocery shopping. No, Michael, you will come over after 9:30. You know my routine in the morning. Yes, Mom, I'm sorry, I didn't mean to mess up your routine. So, we're all in our patterns. That's okay. That's fine. Let's hear from a final expert as we close out the 10 warning signs and go on to the next topic. So, interpreting signs and deciding next steps. Here we are back with the Garcias. The sisters are going back and forth. Did you look at the warning signs? I did, but I still don't know what's going on. How do we know if it's serious enough to see a doctor? And again, they're checking back in with Dr. Soloway. So we're going to hear from Dr. Soloway.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then if things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people, but they don't have to check up all the boxes.
So Dr. Soloway gave us a good recap. Again, these warning signs are intended to be a guide. Not every individual is going to experience one or all of the symptoms or signs, and it's important not to say I need to check off every single box. It's important to discuss any changes we're noticing, though, with our loved ones or with the doctor. I know my mom's dear friend who they've been neighbors and they've gone to the senior center together. They've gone on walks. In the last 2 months, Mrs. D doesn't want to go to church anymore. She sounds strange on the phone. Even at one point, she told my mother, I think something's going on with me. And it's important for family members, if you're noticing changes, to have that conversation with each other. My mom reached out to one of the cousins and she said, yeah, I've been noticing things, but I think Mrs. D is just tired. She's not sleeping like she used to, but clearly something is going on. She's not her typical self. Anyone that you're familiar with, if they're not their typical selves, use these warning signs to get them to a doctor. It could be another medical condition. Sometimes, particularly as we age, we're on multiple medications. They may have, impact on our cognitive functioning. Somebody with diabetes may have an issue that's going on that's impacting their cognitive functioning. Somebody may have had an actual mini stroke and it's impacting their cognitive functioning. So whatever you're noticing in terms of these warning signs, please ensure that you're reaching out to a healthcare provider for further assessment. And we'll go further into that as we get into the presentation. Let's move on to the next few slides. So the importance of early detection, figuring out what's going on. We're going to hear from an expert again.
You know, it's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they say, boy, this is starting to happen a lot. And the person's not aware of it. So the family's more aware, and they may talk to their loved one about it. And they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
All right. So we'll skip this one, but I just want to reiterate what Dr. Soloway was saying. Someone who may potentially have Alzheimer's or other forms of dementia, they may not be aware. So talk with other family members, talk with each other. My mother's hoping that Mrs. D's daughter and her cousin will have a conversation with each other and do something in terms of getting her to get assessed for that sake of early detection. Is it indeed dementia or Alzheimer's, or is it some other medical condition? Let's move on to the next slide. So what you should do if you're noticing changes in someone, let's talk about this. I think it's important as we help you with this roadmap. So there's 10 steps. Assess the situation, okay? And going through these steps, the final endpoint will be going to a healthcare provider, going to the doctor. So let's go to number 1 first. So what changes in memory, thinking, or behavior do you see? Again, if somebody's not acting their typical selves and it's been going on for quite some time, is it stress related? Is it depression? Is it a mini stroke? Are they under tremendous stress? Has something recently happened in the family? Those sorts of things. So these, might be triggers, but figuring out what's going on is important, particularly as we're looking at memory and one's behavior. Moving on to the next one. What else is going on? As I said, are there changes in the family? Is there some stress-inducing indice that's happened that's creating it? Was there a loss in the family? Somebody may be dealing with unresolved grief, things of that nature. Somebody just recently moved and they're not adjusting to the new environment, that sort of thing. So being aware that there could be some other environmental or social factors playing a role in what we see in their cognitive challenges. Number 3, learn about the signs and the benefits of early diagnosis. So keeping in mind the 10 warning signs that we just went through and getting an early diagnosis. Because again, it could be something else, or unfortunately, it could be some form of dementia. And getting an early diagnosis, if somebody's at the mild cognitive impairment stage or the very early stages of Alzheimer's, there's some promising medications on the horizon that could be a benefit. Also, there's clinical trials that they could avail themselves of that might help with certain aspects, language acquisition, dealing with agitation, whatever the study might be assessing, that might be of some benefit to your loved one, depending on where they are in the journey of Alzheimer's or other forms of dementia. Number 4, Again, has anyone else noticed the changes? So if you're noticing things, don't keep it to yourself. I would encourage you to take some notes. Today I noticed that mom did XYZ. Mom usually does ABC, but now she's not able to do it. She got lost. So you're having data, if you will, that you can then use when you're ready to have the conversation. And engaging other family members or neighbors or church members who know your loved one quite well. Again, my mom's raised her concerns to the cousin, and the one of the daughters who's been primary has been out of town. She's due back soon. She's been away for about a month or so. Hopefully the cousin talks to this daughter, and they will then have the conversation and take some next steps with their mother. So talking to folks, because you're not alone. Sometimes that happens in families. I'm just going to keep it to myself because I don't think this is serious or this will just pass. But if you talk to another family member or neighbor, whomever, and they're too, oh wow, you noticed that too? Clearly something's going on that clearly indicates a diagnostic process needs to get involved and underway with a doctor. Number 5, having that conversation. Let's talk about that a little bit more. And when we're having the conversation, who should be involved in the discussion? Should it be, if it's a spouse, should it be the husband or wife? Should it be your adult children? So being strategic, we don't want to gang up on our loved ones, so we don't want to have 5 people in the room, and we want to do this in a very calm, supportive, non-judgmental, loving way. We don't want, again, everybody, you couldn't do this, you couldn't do that. Last week you got lost. I remember the time you took the car and you came down. You're going to feel overwhelmed. You're going to feel nervous, scared. Somebody may shut down, that sort of thing. So being strategic, who's going to have the conversation? When's the best time to have it? Have you taken some notes that you can share with your loved one? Number 6. And again, what's the best time and place? If they're more attentive in the morning, having that conversation in the morning, having it at home maybe where it's quiet. Don't wait till the crisis happens and you're, let's say, out at dinner or at lunch or whatever, and some embarrassing situation happens. And again, now you're confronting them and you're in public. That's embarrassing. Making sure that they can hear you. So again, ambient noise. Making sure that there's appropriate lighting and that sort of thing. So the person's most receptive to what you're sharing with them. Number 7, what will you and the person having the conversation say? So again, as I mentioned earlier, you're taking notes. You may even want to kind of have a dress rehearsal of what you're going to say to your loved one. Okay, I'm going to say, Mom, last week I noticed that when you went out to the grocery store, you got lost. The other person may say, sweetheart, I noticed when you brought the groceries home, you put stuff that belongs in the refrigerator in the pantry. And when I got home from work, things were defrosted. That's not like you. So, being able to have that conversation and having a script, if you will, in terms of what's going to be said. Next, number 8. And then, when you finally have had that conversation, be supportive, being able to say, you know what, I think I can go with you. And maybe make it fun in that, somebody may say, oh, I don't need to go to the doctor. Unfortunately, the stereotypic male, we don't like going to the doctors. We don't, we want to deal with healthcare providers. I'm fine, that sort of thing. Hey, I tell you what, Dad, why don't we go and have lunch? And then after lunch, gee, I've got a 1 o'clock doctor's appointment scheduled for you. Or go to the 1 o'clock doctor's appointment. Gee, Dad, I know you like, fishing. Why don't we go to the fishing and tackle store or go to Dick's Sporting Goods and look at some fishing rods? Maybe we can go fishing next weekend. So again, going with them. Maybe also, if you have access to the patient portal, putting your questions and concerns in the patient portal or providing a handwritten note to the doctor, because the first thing the doctor's going to say, dear Mr. Johnson, how are you feeling today? Having any issues? Oh, no, I'm fine. Nothing's wrong with me. But if Mr. Johnson's wife or adult children have teed the doctor up, he's now aware, and maybe he can ask some more probing questions, or maybe he can even do what's called a mini mental status exam. What's today's date? Where are you? What's the day of the week? Can you count by threes backward from 100? So, better assessing, are there some cognitive issues? But being as supportive as possible by going with the loved one to the doctor. And then number 9, if need be, having multiple conversations, because oftentimes it's not a one and done situation. So it's important to be patient. It's important to even be able to say, I know it's hard what we just talked about in terms of maybe you having some issues with how you used to be able to do things. You not seeming to remember things like you used to. I know this is a little overwhelming. I tell you what, Dad, I'm going to keep observing you for another week. If I see this going on again, let's have another conversation. So you may have to have multiple conversations. But decide for yourself how many. Don't put it off for like 2 months or 3 months, and decide, okay, we're going to have about 4 conversations, and I've got an appointment set up in 2 weeks, so that you're being as proactive and strategic as possible. And then moving on to the next slide, having the support, and that's important. And that support may come through, Dementia Friendly. They've got a lot of resources. The Alzheimer's Association, reaching out for support can help maybe give you some other tips or help you plan out your script in terms of what you're going to say and how you're going to engage your loved one. Moving on to the next slide. Again, Dementia Friendly is a resource. The Alzheimer's Association can be a resource. We've got a 24/7 helpline. They can speak any language you want. They're all trained counselors. 24/7 helpline. Gee, I noticed some things with my mom, dad, whomever. Got any resources? How can I have the conversation? Where can I go? Should I go to my primary care physician, neurologist, psychiatrist, so on and so forth? So getting help, I think, is the key takeaway on this slide. You have resources. Dementia Friendly is wonderful. The Alzheimer's Association can be another added benefit. Moving on to the next slide. And then that doctor's appointment, it's critical. Get that early detection, getting a sense what indeed exactly is going on. Moving on to the next slide. I mentioned some of these, so oftentimes we have our family doctors, our family medicine, our primary care physicians, that sort of thing. They may refer you to specialists. A geriatrician is trained to deal with the elderly. A neurologist is a psychologist that does neuropsychological evaluations. A neuropsychologist does neurological evaluations. That's a psychologist. A neurologist is a physician that's trained in brain functions and dysfunctions. A psychiatrist, again, is an MD that can prescribe medications, things of that nature. A psychologist, a clinical psychologist, can do interpretive tests related to intelligence, but they can also do tests that might get at mental and cognitive functioning. So your primary care or family doctor may refer you to one of these specialists, or your family doctor might be, some of our major medical research facilities, particularly affiliated with our universities here in the Washington area. They may have a whole team. Oftentimes there's a memory care or geriatric clinic, a memory disorders program, and they'll have these various specialists as part of the comprehensive team that are each doing their particular assessments to come up with that comprehensive diagnostic assessment as to what's going on and what's best treatment intervention. Moving on to the next slide. So those are the steps we've been through. And again, why have early detection? Let's talk some more in detail about that.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to just make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Okay, so with early detection, they have a voice. They can have some input. They can also offer what they want to have happen. Gee, I do want to get on some medicine. Unfortunately, right now, there is no medication that quote unquote cures Alzheimer's or other forms of dementia. There are 2 medications on the horizon. We're waiting for final approval from the Food and Drug Administration that can help with either mild cognitive impairment or the very, very early stages of Alzheimer's in terms of affecting what's called amyloid plaques that muck up the neurotransmitters in the brain. Some other important things about early detection: paying attention to any changes in memory. If you're seeing these changes that are unusual, taking action, having that conversation, discussing the concerns. And then, as we mentioned earlier, there are a number of benefits to early detection. A person has a voice and a say of what their medical care is going to look like, getting financial and legal affairs in order, that sort of thing. Having a discussion, gee, mom and dad, as if this is Alzheimer's or another form of dementia, how do you wish for us to take care of you? Now, I know in many communities of color, the first thing we're going to say is, you're going to be at home. You're going to be living with me. I'm not putting you in no nursing home or something of that nature. But they may say, I don't want to burden you, Michael. If it gets really, really bad, and that's to be determined, go ahead and put me in assisted living. I don't want to be a burden to you. So, having that kind of conversation would be helpful. And again, trial match, clinical trials, all of these things are important in the earliest phases of what's going on. So moving on to the next slide. Quickly, let's talk about seeking a diagnosis, and I'm aware of time, so we can have some time for conversation. But seeking a diagnosis, and let's skip over this particular test, but what's involved in the diagnostic process? Oh, very quick, there are ways to diagnose Alzheimer's. So in the case of Miss Garcia, again, fictitious, but in real life, these are the various things that go into a clinical assessment. So getting one's medical history, clearly doing a physical exam, maybe doing a mental status exam, ruling out for depression. Again, interviewing close family members or a close companion, because they provide essential data, if you will. And then the laboratory tests, there may be blood tests, urinalysis, as I mentioned, the mini cognitive exam. And then there may be an MRI or CT scan or PET scan that can ascertain, is there any deterioration in terms of brain function? So those are some of the assessments that can better get at what's going on in terms of ruling in or out dementia or Alzheimer's. Moving on to the next slide. Going to the next one, the question is, does dementia always result? And so we're going to hear quickly from the Garcias. They're basically saying they've got an appointment, really dementia. Guess we won't know until we talk to Dr. Soloway. We'll hear quickly from Dr. Soloway, and then maybe we'll
have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So again, the critical thing, and we mentioned this earlier, there could be other things going on. So a quick recap, and then we'll stop and address questions. The diagnostic experience is going to vary from person to person. Something other than Alzheimer's might be going on, another medical condition, as we mentioned a couple of times. I know in certain communities, there's often stigma and misconceptions about the diagnosis of having Alzheimer's or other forms of dementia, but it's critical to get that diagnosis. It's critical to have important information, educational programs like what you all are offering, what the Alzheimer's Association offers, so that we can address stigma and the misconceptions related to dementia and Alzheimer's, because it's a serious illness. It's not treatable at this juncture. There's hope, as I mentioned, the 2 medications on the horizon, but we can offer hope. We can help that person live the best lives they can still have, even in the midst of the trajectory of the illness. So why don't we stop here? If we can pull up that page, though, Michael, that has the 1-800 number and some of the other resources, that can be an additional resource besides the resources that Dementia Friendly offers. So I mentioned our 24/7 helpline. And again, we've got chapters all over the country. Our alz.org, there's tons of resources. There's a whole resource page on caregiving, dealing with certain behaviors. How do I deal with issues around wandering? How do I deal with issues of sleep deprivation, those sorts of things. And we also have, through the alz.org, community resource finders. Are there assisted living facilities out in your area of the DMV? Those sorts of things. So in conjunction with Dementia Friendly, Alzheimer's Association can be an additional resource that helps support you all, particularly those of us who are caregivers, in loving and supporting and caring for our loved ones. So let me stop here.